Welcome, everyone. My name is Dana Fields Johnson, and I'm excited to open today's webinar and welcome you on behalf of Prevention Institute and our partners. You may be familiar with Prevention Institute. We are a national nonprofit based in Oakland, California, dedicated to building prevention and health equity into key policies and actions at the federal, state, local, and organizational levels, to ensure that the places where all people live, work, play, pray, and learn are healthy, safe, and well. Thank you all for joining us. Today's webinar is one of a series of 3 webinars that we will be hosting, entitled Supporting Local Decision Makers Using Opioid Settlement Funds. Today's webinar in particular is titled A Snapshot of Spending and Opportunities. And our intended purpose for today's webinar is to share insights with the field about how opioid settlement funds are being used to support public health solutions to substance misuse and overdose prevention. Please note that today's webinar is being recorded and that we will make slides and our recording available to all participants after the webinar. And again, we encourage you to put questions in the Q&A function and to put your comments in the chat. Next slide. So this webinar series is supported by a cooperative agreement with the Centers for Disease Control within the U.S. Department of Health and Human Services. And the contents of and what's being shared today do not necessarily represent the official views of, nor is it an endorsement by CDC or HHS. Next slide. So our webinar today, we have a few objectives for you. And one of those is really to share what we're learning about the landscape of opioid settlement funds and what's happening around the country with those, and to support you in your opioid settlement decision-making, and also to uplift some of what we know is happening. We also hope that it will surface emerging opportunities for you. One of the other things we hope to do with today's webinar is bring a local perspective on this. So we have Maricopa County here today sharing their work. And then we hope to give you the opportunity to engage in Q&A with our panelists and other audience members. Next slide. Our work with CDC is supported by CDC's Division of Overdose Prevention, and it is a joint effort between Prevention Institute and 4 partners, our partners at Big Cities Health Coalition, who have taken the lead on helping to plan today's webinar, and who you'll be hearing from, partners at ChangeLab Solutions, RTI International, and SheRay and Associates. Next slide. So just a little bit about the project we've been funded with CDC to do. Through this project, we'll be providing technical assistance and capacity building to decision makers to identify, select, and fund evidence-based strategies through opioid settlement dollars that prevent drug overdose and reduce the consequences of substance misuse. We know that as of February 2024, more than $4.3 billion has been distributed in opioid settlement funds, and that billions more will be coming in over the next 20 years. And so we want to make sure that folks are aware of the evidence base and are using those strategies. And also importantly, that folks are lifting up and really engaging the voices of people with lived experience. So our webinar series over the next 3 webinars will seek to do those things. We also will be, through this project, building capacity and understanding for approaches that span the continuum of substance misuse and addiction prevention. And so you see the continuum there at the bottom. And so we really want to lift up strategies across, from primary prevention through harm reduction to long-term treatment and recovery. Next slide. Through our work on this project, there are multiple audiences. Attorneys and legal professionals, our partners at ChangeLab Solutions will be engaging those partners in conversations to understand what they have learned from their settlement experience and conversations, and what their engagement is beyond settlement into implementation of the strategies at the local and state level. We'll also be engaging community members and people with lived experience. We believe that contextual and lived experience is incredibly important to understand opportunities, challenges, and what needs to happen from the lens of those most impacted by the opioid crisis. We will also be engaging public health practitioners through our partners at Big Cities Health Coalition, as well as through ChangeLab and SheRay's associates. And then lastly, we hope to engage state and local government partners and policymakers. Our project has three primary project outcomes that we're looking to achieve. We're hoping to increase understanding in jurisdictions that are making decisions about the use of opioid settlement funds, connecting it to what the evidence tells us and to the relationship between strategies across the continuum. We also hope to increase the use of tools, frameworks, and materials that support substance misuse prevention and harm reduction. And then we know that coordination is really important as we take advantage of the opportunities that opioid settlement dollars have present to us. And so we hope to support increased coordination across partners, sectors, and jurisdictions in support of opioid misuse prevention, harm reduction, and community-informed decision-making. Next slide. Our panelists today include Dr. Jennifer Kolker, who is a clinical professor of health management and policy and co-leads the policy core at the Urban Health Collaborative, Dornsife School of Public Health at Drexel University. Jen and her team, Allie Gibson and Vahan, and I'm sorry, Vahan, if you're listening, I don't have your last name in front of me, led a lot of our work here today, and some of the findings of our landscape analysis. They did a review of plans as well as did some surveying. So they will be sharing highlights of that today. And then we also have Dr. Jeanene Fowler, who's Executive Director of the Maricopa County Department of Public Health, here today to share more with you about their local perspectives on opioid settlement and the work they've been doing there. So I am going to turn it over to our partner, Chrissy Giuliano from Big Cities Health Coalition to get us started. And Chrissy will be introducing you today to our panelists.
Thanks so much, Dana. It's great to be here and to be working with you all at Prevention Institute and the other partners on this project. So really briefly, I just want to share a little background on the Big Cities Health Coalition, or BCHC as we call it, because it's a little easier to say. So BCHC is a forum for big city health department leaders to share best practices. We strategize together on how best to address complex urban health challenges and advocate for urban health, health equity, and the public health field as a whole. So you can see here our mission and vision, which really, as I said, focuses on best practice leadership and advocacy, innovation and leadership, and we've been around now for more than 20 years. So on this next slide, you can see our 35 member jurisdictions. So those health departments collectively serve more than 61 million people, or about 1 in 5 in the United States. So in this project, BCHC worked with Jen's team on their analysis. Findings from this work were used to provide an initial understanding of how jurisdictions are planning to use their settlement funding. And we're really excited to share this information with everyone here on the webinar today. The Urban Health Collaborative worked with several of our member city health departments to begin to understand the needs and promising practices in using opioid settlement funds. I'm also really excited to have Jeanene Fowler, who is the director of Maricopa County Public Health, which is the big city is Phoenix. So really pleased that these partners and members can be part of this work with us today. So while our speakers present, there may be some questions posed in the chat. We're trying to gather some additional information from those of you who are viewing the webinar. So please do share with us. And again, you can put questions for the speakers in the Q&A box, and we will answer questions after the presentation. So with that, I will turn it over to our first guest speaker, Jen Kolker from Drexel's Urban Health Collaborative. Jen.
Great. Thanks, Chrissy. It's nice to be here. I'm amazed at how many people are on this webinar. It's always so exciting to see that participant number just go up and go up. So I will be talking about a survey of select health department staff, community partners from ChangeLab Solutions, and analysis that we did of some publicly available opioid settlement fund plans to, as Dana said, give sort of a little bit of a landscape analysis, kind of what's going on around the use and allocation of opioid settlement funds. And I also want to just reiterate what Dana said too. This was a team effort. Allie Gibson is a project manager at Urban Health Collaborative, really led this work. She knows the ins and outs of the data far better than I do. So I will do my best to answer any questions, but some things we may need to get back to you on. Next slide, please. So what I'm going to talk about, context of this work, BCHC role in our larger project, methodology and focus, some of the limitations, survey results, analysis of the plans, and then some overarching findings and results. And then after that, we'll get to hear about what's happening really on the ground. So the context, what do we do? So the Urban Health Collaborative, and we say the UHC because it's shorter, we did a quick, and I emphasize quick because we didn't have a lot of time, a quick landscape analysis of a sample of jurisdictional approaches to using settlement funds. So we did a mix of cities, some counties, some states. So our findings include a bunch of different things. Information on current conditions regarding the planning and process opportunities, challenges of opioid settlement fund initiatives for select jurisdictions that we did through a survey and online research. Most importantly, this is a snapshot in time. And a lot of that process is evolving and progressing. So you may hear some things today that are from your city or your county, your state, and go, oh, that's not happening, or we're now doing this. We might not have it all because things are moving very, very quickly. The point of the information, this is not a research study. This is not something to publish on. This is not, the facts that we need to present. It's intended to provide background information and insights that, alongside the work that Dana talked about from the other PI partners, will help determine recommendations for future course of action. So it's a feeder of information on what's going on. Next slide. So this is what we did. We started with an electronic survey through Qualtrics. We distributed that to 15 members of Big Cities Health Coalition that formed their substance abuse working group, 35 senior deputies from BCHC member health departments, and 5 of ChangeLab Solutions project participants. We got 24 responses from 22 jurisdictions. That one confused me sometimes, but it means some jurisdictions we had more than one response. And the focus of that survey was on really describing what the conditions were regarding the opioid epidemic in their jurisdiction before the settlement dollars became available. Processes around allocation, coordination, prioritization, and community engagement. And then opportunities and challenges, including political influence. So that was a survey. Then we also did research on a small sample, small meaning 6, of settlement fund plans. So the ones that we looked at were publicly available. We looked at websites, web pages, published plans. Some jurisdictions released their plans very publicly. Others we had to dig around a little bit more. We looked at 3 counties and 3 states. And we really looked at similar things that we looked at in the surveys. What were sort of the funding received, funding allocation coordination, and the focus of the funding and the details of the funded activities. And we came up with those jurisdictions in coordination with BCHC and with PI to come up with what we thought was obviously not a fully representative sample because we only had 6, but to give some range of size of city, geography, and enable us to do sort of a big picture analysis. Next slide. So first I will talk about the survey results. Remember, that's the electronic survey that went out, and then we got about 22 responses talking about allocation, coordination, priorities, community engagement. Next slide. So allocation, coordination of funding, that's what everybody really wants to know, right? Who's deciding and how is the money being spent? Who gets to decide and how is that funding being coordinated? So if you look at the chart on the left, you can see that the opioid funding, by and large, is being allocated to health departments. That's the big yellow piece of the chart. Then also to a consortium of agencies that cross jurisdictions, to an agency within the jurisdiction, but not the health department. Remember, there's nothing in the opioid settlement dollars that says it has to go to a health department. And it ranges in different cities about who has sort of ultimate responsibility for substance abuse work. It's not always the health department. And then to a consortium of agencies within the jurisdiction, and then some other combination of that. And then if you look at how opioid funding is coordinated, it's pretty much the same, falls under the same categories. So for both allocation and coordination, consortiums involve the health department. And for allocation and coordination, other agencies usually included the mayor's office, some kind of county government, so some executive branch, county health departments, and in some instances, health and hospital systems. So that's sort of who is involved with the funding allocation and the funding coordination. Next slide. So who sets priorities for funding? So funding gets allocated, and then priorities get set for how the funds are spent. So if we look at the first chart on the left, who's determining priorities? Local health department, another local entity, an independent advisory board, and then most people said other. Box on the right talks about what that other looks like. Consortiums with the health department within a jurisdiction, consortiums across jurisdictions, consortiums without the health department, some kind of a community engagement process, and unknown. So groups within the jurisdiction included advisory boards, stakeholder groups, mayor's office or chief executive office, city council, behavioral health, homeless service, and different opioid response units. Next slide. So community engagement is obviously critical, and Dana talked about this at the beginning. And I think pretty much everybody in public health and public health planning will recognize that community engagement is a key part of determining funding priorities and allocations in any kind of successful intervention. So not surprisingly, we saw the community engagement processes were used to inform spending for 78% of the respondents. And those were captured in different ways: surveys, interviews with stakeholders, community listening sessions, stakeholder meetings, community needs assessments, local research, public attendance at different meetings. So both the combination of kind of in-person, high-touch engagement activities and some that were probably a little bit more passive, like surveys. Next slide. So the results of the surveys, how settlement funding is being used and what the focus areas are, the opportunities and the challenges. Next slide. So probably any of you engaged in this work, none of this will be too surprising. So the prioritized focused areas were the top 3: harm reduction, treatment recovery, prevention, education. And I should say that we know that those categories are not always mutually exclusive, right? There's overlap between treatment and recovery and harm reduction. And often treatment and recovery involves prevention education. So while these are 3 categories here, we know that there's a lot of overlap. The other areas that came up were data collection and modernization, housing and other social services, and housing that came up in a lot of different places. Law enforcement and public safety, and then of course the other category. And other included funding treatment in jails, EMS and prison outreach, and other funds that were allocated toward community grants and community advisory boards. Next slide. So the most referenced opportunities, we ask people like, well, with this new funding, what are the opportunities here? Are you going to only do what you're doing now, or are there opportunities to do other things? So increased prevention campaigns and activities, wide dissemination of harm reduction strategies and supplies. And we know that that's an issue that is coming up across the country about how much cities and states will be able to do that. Increased treatment capacity, including new treatments. Again, as I said, investment in housing resources for people who use drugs and those in recovery. There's just a clear link between the harm reduction work and dealing with this crisis and housing. And I think that we're seeing that a lot in this work. Data infrastructure and surveillance, interagency collaboration, and then a real desire to do targeted population approach. Incarcerated, pregnant women, people with mental illness, recognizing that dealing with an opioid crisis is not one size fits all, and that the ability to target interventions and different outreach approaches would be really useful. Next slide. And some of these examples that people reference, I just said some of them, but increased distribution of Narcan and methadone, wraparound services, again, housing, faster data collection analysis to inform real-time public health interventions. I think that's a critical one, that very often we see data so far down that we already have a spike in a population that we're not seeing in time to get there. Coordinating, collaborating with other counties and cities to maximize regional opportunities. And that's an opportunity, and we'll talk about also as a challenge. And then providing general financial assistance for kinship care, for child protective services not providing. So really making sure that we're sort of lifting up families overall that have been impacted by opioid overdose. Next slide. And then challenges, because of course, with every opportunity, there's challenges. Coordination across government agencies and non-governmental partners, always a challenge. Managing expectations of what the funding can do. There's always this expectation like, oh, there's a new funding stream. We're done. We can do so many things. And the recognition that we need to manage and figure out what we can do and where this money will go. Sustaining current programs, initiatives while we do new things. Data collection, again, always a challenge. And then this balancing of immediate funding need, harm reduction and treatment services, these critical needs, but also recognizing that there need to be systemic investments in the drivers of the crisis itself, and this desire to get away at some point when we are able to a crisis response to a much more longer view. Next slide. So that was the survey. Now I'll talk a little bit about the settlement fund plan. So we did, again, high-level findings, quick landscape review. We looked at Arizona, California, and North Carolina. Those are our states. And then our counties, Maricopa, and we're about to hear way more about that, Mecklenburg in North Carolina, and Milwaukee. So Mecklenburg and North Carolina were matched, Arizona, Maricopa were matched, and then California, because it's big and it's where PI is, and then Milwaukee is another, something in the middle of the country. Next slide. So we looked at very much the similar categories as we did with the survey. So we looked around engagement, allocation, and coordination. Once again, community engagement processes used by 4 of the 6 jurisdictions. And I say 4 of the 6 because that's what we found. Doesn't mean that the other 2 aren't doing it. Remember, we were looking at these plans and reviewing what we could see in front of us. Doesn't mean that it wasn't happening. Other thing that's important is that the plans, some of them talked a lot about the process, and others talked really more about what they were going to do. So it's very possible that people had a lot of community engagement in the process, but the plan focused more on what they were going to do. Similar to the survey, the examples included community listening sessions, engagement events, community meetings, neighborhood coalitions, a whole range of engagement of community members and stakeholders. Next slide. And the way we looked at the plans, we also looked at the allocation of settlement funds for states and for counties. And again, the N is 6 here. So it's most important, really, the take home about this slide is that it was sort of a heterogeneous approach. Sometimes things went to state government, sometimes it went directly to the health department, sometimes it went directly to the local government itself, sometimes funds went to the health department. So it's a bit of a mishmash. It would be great to actually look at all 50 states and every jurisdiction and get a true number for how this worked. But the point being here that this allocation of funds And the coordination really varies by geography and jurisdiction and governance. Next slide. So focus areas and details. These are, again, were the things that we were able to pull out. And remember, I said that for the prioritized areas of impact, prevention, education, harm reduction, treatment, recovery, not always mutually exclusive. Some of the different areas of focus, prevention of overprescribing, misuse, prevention of overdose, evidence-based treatment, ranges of target populations, and different types of activities. And again, it's really, really a range. Some things we saw everywhere, and some things we saw in very particular different plans and jurisdictions. So I'll give you a moment to look at this on your own. I won't read your bullets for you, but there's definitely a range of things here. And probably the biggest challenge is on a lot of this treatment and recovery in terms of resources, because obviously expanding treatment is one of the most expensive things. And when we talked about some of the challenges, issues around accessibility of naloxone and distribution of things around syringe exchange, those came up more often as in harm reduction as things people wanted to do, but there were some definite political challenges to that. Next slide. So opportunities, that was the goal of this. Remember back at the beginning, what are some of the opportunities that this settlement funds might lead us to? Prevention programs that are culturally competent and engaging and up to date. Institutional and interpersonal stigma around people with substance use disorder. Media, early intervention, syringe exchange programs, evidence-based addiction treatment and treatment for incarcerated persons and expansion of medicated addiction treatment. So all sorts of different ways in which we can increase addiction treatment. Mobile units, culturally responsive recovery supports, housing and other peer supports and wraparound services, and justice diversion and deflection. Those are some of the things that the opportunities as we thought in a new way about doing things. Combination of continuing the things that people are doing, but also some new things that we might not be doing as much, or that maybe some jurisdictions are doing, but others would like to begin. Next slide. So some of the common themes across the surveys and the plans. So allocation coordinated funding is largely focused on health departments in coordination with other government agencies. Focus areas, not surprising, prevention, education, harm reduction, recovery, and treatment, with some other things. And they really align, the plans really align with what we saw in the surveys in terms of opportunities and challenges, which is good because they're a little bit of a consistency check. And then the types of activities and the challenges identified are good indicators. This is where we can kind of turn to PI and the PI partners and saying, this is where we think people may need TA or support or help or peer learning around collaboration across campaigns, naloxone distribution, data infrastructure and surveilling, housing, workforce development. All of those kinds of areas are ripe for assistance and support. Next slide. Oh, that's it. So I will leave it there. And I guess we're going to do questions at the end, and I will turn it over to Jeanene.
Thank you, Jennifer. Well, thank you for having me today. A little intimidating, 226 participants right now. Just a shout out to, there's a lot of my friends and colleagues from Arizona. So thank you for getting on this morning. Appreciate that. I also wanted to shout out to our State Opioid Use Treatment Authority, or our SOTA. If you don't know what a SOTA is, I encourage you to look it up. Every state has one. Ours is Kate Dobler, so I appreciate for her tuning in today. I'm going to go through where we are now with opioid settlement dollars. Spoiler alert, I don't have all the answers, so sorry about that. We continue to all learn together, so I'm hoping to learn some new things myself today on this call. It's also important, we're doing our best to be nimble and responsive to the environment and to what's going on, so I encourage everyone to try to do the same. We're all in this together, learning from one another. So next slide. Just a quick overview of Maricopa County Public Health. We are the third largest public health jurisdiction in the US. 4.5 million residents. We're the local health department for all of our 27 cities and towns. We represent about 62% of the Arizona population. We're larger than 4 states. We have 5 tribal reservations, and we are a mix of urban and rural. So next slide, just to give you a little snapshot of who we are. I think it's important to know for us, which is not the same for all jurisdictions, but we are, our state set up what we call the One Arizona Agreement. I put some links in there in case anyone's interested, but 25 of our cities and towns are also receiving settlement dollars. And why that's important is that, as I said, the previous slide, we're the health department for all these cities and towns. So they're not quite set up necessarily to with the infrastructure to manage these monies. So I'm just going to talk a little bit in future slides about what we did to try to bring us all together so that we're all singing off the same playbook. Next slide. So this is a little quick snapshot of the payments to Maricopa County. Just wanted to give some perspective. You'll see that the total anticipated, it's about 50% to Maricopa County government, public health, and then 50% to our cities and towns. So that's sort of, it's a moving number, as most of you know. That's what we're looking at right now. Next slide. And this has been our spending to date as of March 29th. If you're interested in sort of our spending or our dashboard, I did a link to our settlement webpage. But as you can see, we have a lot more money in the bank than what we've spent. And some of that is that it's come in recently. The other reasoning behind that, and I'm going to talk a little bit more about funding, is that we're trying our best to weight this money over a 5-year period because there's peaks and valleys. As many of you know, it's just really hard to budget appropriately. So we have been working really hard to see how much should we be spending annually so that we can weight it over time. Next slide. Okay, next slide. Another I thought it'd be important to talk a little bit about how we prepared for our settlement dollars. And the first thing, we were given a very short timeline by county government to do our needs assessment, which we felt like we had needed. We hadn't had a statewide assessment since prior to COVID. So our provider needs assessment, we started it in around January of 2023 and completed it in May, which was kind of a whirlwind. And because we didn't have a lot of time, we focused on our community-based providers in the community. And we worked with both all our large cities and towns, and we put together an advisory board making up these community-based providers. And as part of this analysis, we did a trend and funding analysis. So we reviewed existing data and literature. We also did direct data collection. So we did an electronic survey, which we had about 500 staff and volunteers complete on behalf of community-based organizations. We did 17 key informants, 10 listening sessions, and we structured a situational analysis assessment and prioritization for our strategies by the advisory committee. And the next study, because that study or that assessment did not really did not include people who are with living experience, we also complemented that with another assessment of people who use drugs in Maricopa County. That was done through April through June of 2023. We had about 500 community-based and government staff working on that study, and participants represented approximately 30 organizations in the public, private, and nonprofit sectors. And so working with all of those organizations, we received about 525 survey responses, and we completed 40 interviews. So I encourage you, if you get some time, it's a very interesting study that we did, and together we put both of those assessments together, and we developed our Maricopa County strategic plan, which we had never completed a substance use strategic plan. So we're very excited that plan was just completed. If you go to the next slide, these are I just pulled out a few of the themes from our provider assessment. None of these are going to be a surprise to anyone. Social determinants and equity, systems, policies, provider partnership and capacity, and data and evidence. And then the next slide are our themes for our people who use drugs survey. And we go into more depth, obviously, in the assessment of of these themes: housing, reproductive health, health services of basic needs, substance use treatment, drug use and harm reduction, and energy assistance. So our going back to the 5-year substance use prevention and response strategic plan, next slide. The way we developed it is it's a overall, and I'm going to show a snapshot of it, 5-year plan, but we're doing 1-year action plans. And we feel like this is going to give us, allow us for versatility and responsiveness to the community. It also will allow us time to look at evaluation data annually and make quicker decisions. And it's also on the same cycle as OD2A and our department strategic plan. We also we share measures with the county strategic plan and our department strategic plan. And as I discussed before, we're trying to weight that funding in 5-year increments. So everything that we're doing is on the same cycle. Next slide. This is just a snapshot of what our strategic plan looks like. Again, you can see the whole thing on our website, but we have 6 focus areas. And what I wanted to call attention to, which was really important to us, is how are we going to evaluate whether we're having any impact? So we know we are not going to have the infrastructure to dig as deep as we want, maybe into each of these focus areas, into the evaluation components. So what we've looked at is, what do we already have readily available to us that we can look at over time? So these are just some of the sample sources that we're going to use to monitor progress over time. I'm going to talk a little bit about evaluation in a minute. So the next slide, really, these are the final 3. So the first 3, and these are the last 3 focus areas, set up the same way with our objective action areas and sources for monitoring progress. Next slide. So evaluation is very important in knowing is what we're doing having any impact. So I talked a little bit about linking those existing sources to the objectives to review over time. We're also working closely with all of our community-based contracts with our in-house evaluation team to ensure that there's consistency, and that we're helping our community-based agencies hold themselves accountable to the work that they said that they were going to do. We're also talking with Arizona State University and the state overall with this concept of, could we possibly develop statewide evaluation metrics to which maybe all of the counties are using with their settlement dollars, and we're all contributing to sort of the same metrics over time. We haven't quite got there yet, but that's sort of our dream and what we're trying to do. Really important, I guess, to note is that I'm just talking about monies coming into Maricopa County, but there's also another whole very large pot of money that's also going to the state of Arizona. And that money is still, there's not a plan in place yet of how that money is going to be used. So next slide. So this is sort of the meat of how we think about the work. And the first piece is about our partnerships. So I talked a little bit about the 25 cities and towns that are also receiving money. So in years 1 and 2, 1 being 2 years ago, this is year 2 of that, we initiated an internal fellowship program. So what we did is we brought in master's level students for 2 years, and we teamed them up with our largest cities. And the whole concept behind that was, how do we bridge what the cities are doing to what we are doing in public health, and also to create a workforce development opportunity for those students who are coming out with a master's degree, to give them some hands-on experience. That we're just concluding that fellowship, and we've decided we've actually transitioned to quarterly regional roundtables. Next slide. And what we've done is back during COVID, this is the Maricopa County. We've separated the county into 5 regions. Each of our regions has what we call a public health liaison, and their responsibility is to know the ins and outs of the region. And our public health liaisons now have transitioned from the fellows to working with all of the cities and towns in that region, bringing them together at least on a quarterly basis to talk about what their successes and challenges have been around settlement dollars, and also to share what public health is doing. Next slide. Just going to quickly highlight some of the partnerships that have been vital to us and continue to be vital. The first I mentioned our SOTA, but Medicaid, or in Arizona, it's called the Arizona Healthcare Cost Containment System, or Access. And this has been a great opportunity for us to work closely with Access. Medicaid there's a lot of money coming into the state through Medicaid. So how do we make sure we're leveraging those dollars and collaborating and having working with settlement dollars to potentially work on issues that maybe Medicaid is not able to support? Another important piece about Medicaid is looking at how any of the 1115 waivers will impact substance use. Right now, Arizona is looking at how our 1115 waiver might be able to support those leaving incarceration. So potentially Medicaid would pay for people who are incarcerated for 30, 60, 90 days prior to release. Right now, that whole, all of that funding is the county pays for that. Also working closely with our state health department. Unfortunately, right now, the state health department nor Medicaid is getting any of the settlement dollars for the state of Arizona. They're all sitting at the Arizona Attorney General's office, who's also an important partner with us. City of Phoenix has been a vital partner for us too. They've recently stood up their own a public health office, I would say. There's 2 people there, but it has allowed us to really work closely with them to develop projects like we're developing a library. They've developed a library program making naloxone available in their libraries, and we're working with them now to see when we rolled out the program, there wasn't enough naloxone to go to maintain at all of their libraries. So what we're doing now is we're doing a pilot project where we're going to flood all of the libraries with naloxone to see how much naloxone would we really need month after month if we were going to stand up that program, and then potentially expand that to our other libraries in the county. Correctional Health Services has also been a really important partner for us. You'll see in a minute with my funding slide that a good portion of our money went to stand up a opioid use disorder treatment program in our jails, which we're really excited about. And now we're looking to refine that and make sure that that navigation to treatment outside of jail is seamless. Next slide. A few other really important partners for us, the medical examiner. We're working really closely with the medical examiner, obviously on all of our data, providing us data on fatal overdoses. They're also very much involved in our overdose fatality review board, as are a lot of these partners. Both universities we're working with to stand up various activities. I think we're still a little I would say new and putting together initiatives with both U of A and ASU, but I think they're very involved in substance use, and I could see us doing a lot more work with them in the future. The Arizona Alliance for Community Health Center, it's our statewide organization that oversees all of our FQHCs. So early on during Overdose Data to Action, we supported a staff member full-time at the Alliance to support all our FQHCs with capacity building. We're continuing to build on that partnership now with things like they're now working on trying to get vending machines in our FQHCs. Sonoran Prevention Works is our harm reduction provider. They've been just so integral to our work because, as you can imagine, in a conservative community, there's a lot of harm reduction activities that we're prohibited from doing as the county health department, but that's where great partnerships like Sonoran Prevention Work have really stepped in. Next slide. So a little bit about our funding. I wanted to give you all a sense of how we fund substance use in addition to the settlement. So obviously settlement has been great because of the flexibility that it brings. We also are lucky to be funded as overdose data to action. We're funded by CDC for that. We also have received a Juul settlement. We have justice reinvestment funds, state tobacco tax, Senate Bill 1847, which was medical marijuana, state opioid response money, and ARPA dollars. So there's a lot at work here to try to, a lot of balls in the air, and there's obviously limitations to what we can do with each of these dollars. We've tried also to make sure that we are considering equitable funding approaches. And two of the things that we did around equitable funding is during our assessment, we heard loud and clear from our community organizations that they really needed a 5-year funding commitment. So for our first round of funding, we have tentatively committed, because we need to go to our board annually, but budgeted for 5-year cycles for our community organizations. Another approach we used is a fiscal agent approach. So we put out an RFP to hire a fiscal agent who is managing some of our justice reinvestment funds and able to get money to small CBOs and small coalitions who otherwise have a really hard time doing business with Maricopa County. So that's been in existence for about a year, and we're starting to see some really nice partnerships, and it's really paying huge dividends and getting that money to places in our community that public health would have normally a hard time, I think, accessing. And then just a few examples of how we're braiding the funding. I mentioned that OD2A was funding vending machines for our FQHCs, but OD2A does not fund what's in the vending machines. So we're using settlement funds to supply naloxone for those vending machines and potentially other harm reduction items. We're currently working on a prevention plan that's going to braid Juul settlement dollars and opioid settlement dollars for youth prevention activities. And we're braiding OD2A and state opioid response funds to fund our opioid fatality review board, the coordinator, and then the OD2A will fund the coordinator, and the settlement funds will fund the recommendations that come out of that board. Next slide. And this is just a model that we're playing around with, so I thought I would just throw it out for consideration. We all think that Ryan White is a really great model. While it doesn't work exactly for what we're doing for substance use, we think there are components of it that could make a lot of sense, such as the planning councils that brings together those with lived experience to help decide where funding is going for Ryan White. This is something we're considering going to our board to ask for approval to look at how we're spending money year after year. And these are just some percentages we put together. This is very rough, but I think it's a different way to look at how do we make sure we're being consistent across all the realms of our substance use response, and making sure that we're thinking about everything that needs to be considered. So treatment and recovery, one of the reasons that's so high is we're funding the opioid use disorder treatment program in the jails. Next. This is what we did in year one. More information can be found on our website, but as I talked, $2.5 million going to correctional health. We have about $2 million that went to community-based RFP awarded projects, $750,000 for naloxone distribution, with more that came in from the state, and about $170,000 for staffing. The reason for year one, we wanted to make sure we were getting money into the community, but we were not yet done with our strategic plan. So we were a little more conservative than I think we will be in year two, which is upcoming. Next slide. And this is what we're looking at for year two. Big caveat, nothing's been approved yet. We're not quite in year two yet. It's going to start after the new fiscal year in July. But these are some things on the horizon. We're looking at continuing to fund correctional health, continuing to fund those community-based RFPs, putting out some more community-based RFPs based on what data and what we learned in our strategic plan. More funding for naloxone distribution and supplies, more funding for staffing. We're looking at a potential pilot with some of one or more of our health systems with paranavigators in the emergency rooms. We're looking at potentially funding Behavioral Health 360, life skills curriculum for schools, some fees for licensing to increase workforce capacity, and standing up a community advisory board. Next. I just wanted to give everybody an idea of what's keeping us up at night. Things like how much money should be kept in-house, justice related versus supporting community agencies. We've had a lot of discussions on, we want to make sure we're getting money out into the community. But we also have some needs at Maricopa County. So what does that look like? Without indirect on the settlement, how do we maintain our internal staffing infrastructure? How are we ensuring we're looking at strategies with a health equity lens? How are we thinking about and implementing evaluation to make sure we're having an impact? How are we engaging all political ideologies with our evidence-based framework? How do we continue to look upstream while dealing with what's in front of us? How do we stay aligned with other services happening in the community to reduce duplication and maximize resources? How do we grow harm reduction programming in a conservative environment? There's many, many more, but I just took some of the big ones that are keeping us up at night. Next slide. And that is all I have today. I know that was really fast. Happy to take any questions.
Thank you so much, Jen and Jeanene. Jen, thank you for that high-level overview of the landscape analysis and for reminding us that the landscape is changing quickly and it's changing daily as folks are getting opioid settlement funds and thinking about the best course of action. Jeanene, thank you for that very insightful, I think an exhaustive overview of what's happening in Maricopa County. These are huge issues. And so I am really struck by that list of questions that you all are grappling with. And I also found it really interesting to hear you talk about some of the budgeting considerations and how you all are thinking about that, and as well as how you're thinking about evaluation of your efforts. We do have a couple of questions coming up, Jen and Jeanene. Keith So asked or commented, it would be interesting to see how much of the funds are dedicated to educating children and teens in public schools. So I don't know if you want to speak to that specifically or have a lens on that in Maricopa. And then Jen, I don't know if you're able to kind of speak to that more broadly in terms of what we learned in the landscape analysis. Jeanene,
I mean, I can just say in the landscape analysis, we didn't get into specifics on populations and certainly on the distribution of funding. So I'd be very interested to hear what Jeanene has to say. But it's certainly, I think, probably the next, as we think about the next iteration and as places get things going. And Jeanene, I'm so struck with what you said about the Ryan White Care Act, because I started my public health career working on Ryan White Care. But over time, we were able to aggregate across the country by jurisdiction how much is being spent on things like children. So I think it is also a great model for that question.
So an opportunity, it sounds like, Jen.
Yeah.
Yeah, as far as we are, just for scale, we have 54 school districts in Maricopa County. So it's never an easy task when we want to roll something out to schools. So I think right now there's a couple of things we're thinking about. I alluded to, our tobacco team and our substance use team are working with Juul settlement to see potentially what we're thinking about doing is rolling out, seeing if we could purchase curriculum that could be used by our school. So more of life skills curriculum that our schools could adopt should they want to. we don't have any authority over schools, so it's really, we have a lot of conversations with schools about what they're looking for, and we're trying to consider a population health approach where we could support what we could support schools with, and that's where curriculum sort of came from. Not to say that would be the only thing. There's also we're starting to think schools aren't always the best place either for a lot of this. So really thinking about other places where our youth are at and where those other access points might be, and how we can work with those access points, such as maybe it's after school programming, maybe it's Boys and Girls Clubs, whatever that might look like. And we're also thinking about how we better empower youth. So how do we do already have some of that work going on in the tobacco space. So how do we sort of adopt that for all substances, and growing sort of youth advisory boards and things like that, where youth have a seat at the table and are making more decisions?
A lot to learn from, I think, what we saw when tobacco settlements came out, and a lot, I think, that can be applied in terms of the youth advocacy and leadership we saw in that movement. So I'm so glad you brought that up, Jeanene. I think to your point, Lily Onati, I'm sorry if I'm saying that wrong, Lily, or Lily, made a comment. Something we are seeing in our community is an increase in youth overdose. There is a lot of effort to educate adults, but many school systems and districts are gatekeeping youth and access to them. Not allowing programming and education on campuses is a large part of the problem. So I think we see here her also acknowledging, I think, some of the challenge that you mentioned around programming in public schools, and that they may not be the most ideal place to start. So and also, I think there's a connection she's making to reducing vaping and tobacco there. Another question we had is from Melissa. Hi, have you heard of any groups who are not spending 100% of their funds and investing a portion of it to allow for future returns and increase funding over time after the settlement funds end?
We've talked about that. It's not something that our board right now is very interested in. They want us to spend the money that we have. But I have heard that. We've talked about the same thing.
So another potential area for us to learn more about over time as settlement funds get implemented. And thank you for sharing that perspective from Maricopa as well. Another question here is asking if one of the panelists can speak to how cities and counties can sustain funding and or investments over many years. I think that's one of the questions people are grappling with, like, how do we sustain what started here and what may be working? They also said settlement funds are dispersed on a rolling basis over many years. Investments may span multiple administrations in local elected terms. We know that can also impact sustainability of work. How are you sustaining focused investments, diversifying funding sources, and or budgeting long-term? Not sure if there's more you can say to that, Jeanene. I know you spoke to that a little bit.
Yeah, I think that that funding model that I showed, that is one sort of way we're trying to look at it over time, because we also appreciate that it's going to cross many administrations, and we're trying to figure out how do we create a system that that can be sustained and that people can invest in because it makes sense over time. So what sort of models can we put in place? And that was sort of our first draft. I'm sure it will change over time of how we're looking at settlement dollars. I think also we're trying to, because they're up and down year to year, our best, and this could change too, but trying to weight that over a 5-year cycle was the best we could come up with, to try to take like little bites out of the elephant, and then after that 5-year cycle, kind of do that same thing again. That may or may not work. That might get changed, but that's how we're looking at it now.
Thank you. And I think that again speaks to the ever-evolving nature of the settlement funds coming out, folks starting to do the work, coordination across partners and efforts. I also appreciated, Jeanene, your slides on how you are partnering and who some of the key partners. And we know that if we're going to effectively address substance use disorder and opioid use disorder, it is going to require partnerships that balance resources across the prevention continuum. And I think that also are balancing kind of looking at the crisis aspect of it, as Jen talked about, versus how do we move upstream to a primary prevention space. Daphne also asked a question, and it was kind of a statement and a question. So Daphne, I hope I'm presenting this. She said, geographically speaking, perhaps maybe there should be a regional consideration for a conglomerate of areas that are urban who share similar features. Any thoughts on that, Jeanene or Jen, the value of kind of looking at things regionally more?
Well, I think that's why one of the big reasons we split the county into 5. We're trying to make it a little bit smaller, and we're trying to be that conduit between all the cities and towns in that region, so that they're thinking about it together. It's not a perfect process, but at least bringing people to the table, in my opinion, because the cities and towns aren't really set up for it. Oftentimes we're seeing police come to the table, and which is great, but they come with a different lens than maybe other pieces of the city. So how do we stretch that a little bit and help cities to think about other ways they could be spending their dollars, and then also bringing our ideas to the table of, hey, we'd like to do this in your community. You might be able to use your settlement dollars to do this that would sort of add value to what we're already doing.
I noticed you talked a little bit, thank you for that response, Jeanene. You talked in your presentation about the value that Maricopa County had in the planning process around engaging people with lived experience. What plans do you all have to continue that engagement as you learn more? And as you also seek to really make sure there's accountability throughout the process?
Yeah, thanks for that. We've talked a lot about just because of our size. We love the idea, again, sort of like the Ryan White model of having some sort of an advisory board. And I think right now we're just trying to think about what that looks like and how we do that so that people feel included, but we also don't have 100 people in an advisory board. So it's a little, that's, I think, one area. We're committed to doing it. We just haven't really figured out operationally how we're going to do it.
Yeah, and I think that robust group of partners you have around the table, some of the providers you may be working with, harm reduction, field, and others, I think will be instrumental in helping to figure out the best way to do that and to make sure it's happening. Our actually second webinar in this series is going to feature around working with people with lived experience and why that's important, and principles and strategies around doing that. We don't have the answers, right, about how to do it in this opioid settlement. But one of the things we hope to do is lift up the importance of it, right, long term and throughout implementation of strategies that are being funded, but also to understand why that's so important. No, Jen, jump in.
No, I was gonna say, I think that there's a little bit of a recurrent theme here. I think again about sort of what are the things that we've learned before from Ryan White Care Act. That was the first time where we were sort of told, community engagement and the input of consumers and people living with HIV and AIDS is not fluff, it is required. So how did we learn, and what lessons can we take from that? What lessons can we take from how we manage COVID-19? What are all the things we've learned and that we can bring to bear? And how is this different? So I think when I think about the opioid epidemic, I think it's people with lived experience. It's also it's also families who've been affected. Sometimes it's not only the person who is suffering from addiction, but it is the parent or the child. So I think it's important that we bring to write all of those lessons. Like, what have we learned and what can we apply so we don't always feel like we're starting over.
Starting over.
And it gets back to the thing we talked about earlier, just about settlement funds. Like, we've been down this road before with tobacco, and it started out great. And then sustainability became an issue. And then we had a recession, and governments took that money and filled non-tobacco related holes. So there's some cautionary, it's like, what are all the great things? What are the cautionary tales? And how can we bring it all to bear on what we're facing right now?
That's a great point, Jen. I love how you have connected it to what you learned in your early work with Ryan Wright funds. And I actually was in a health, yeah, and I actually was in the health department years ago when the tobacco settlement dollar, and we were doing wonderful work with youth and youth advocates and, you know, campaigns and outreach, and the youth were developing these messages, right? And all of that funding sort of went away. And one of the things we are seeing with, particularly with our partners in California, we've had some of them reach out to say, how is what we've learned from tobacco and the tobacco settlement applicable to opioid settlement? So I think that, and you also mentioned ARPA. What have we learned, and what are the opportunities, right? To really apply those lessons, but what are also those cautionary tales? I always say the best lessons sometimes are in what we didn't get right, right? And also, I won't say failures, right? But just what would we have done differently? So I think we've got about 5 more minutes. Jeanene, what's the best advice you can give someone who's in your role out there in public health or some other agency leading this? What would you just practically tell them if you had one bit of advice you could share?
Well, I think that where we started, if you're starting from scratch, it's really to do that environmental scan because the work's going on. So we started with Medicaid. We knew that they're really the leaders in doing this work. So really trying to understand their plans, and as well as the state health department, because from a local perspective, you know, really trying to understand that environment we thought was super important. And that's kind of where we jumped off. It was really difficult. There's just so many different ways money is coming in, because it's not just government dollars. There's grant money coming in. There's foundation money. So really trying to get your arms around that. It was very challenging for us, but I feel like we're in a pretty good place now. But it's been a year and a half, so it wasn't a quick process. And then, you know, being nimble, I can't stress that enough, that just because we said we're going to do this, we have to be okay that maybe what we said we were going to do last year isn't going to work this year because the environment's changing. And sometimes even the political environment, like maybe, you know, we have parties change all the time and they have different priorities. And sometimes that's an opportunity for us. So maybe things that were not something we didn't think we could do last year, maybe next year is a new year. Maybe it's vice versa. Maybe something we were doing, they're going to put the kibosh on, and now we've got to think about how we do that with a partner organization, or, you know, make sure it still gets done in the community. So I think it's sort of always having your ear to the grindstone and being nimble of how you're going to change to meet the needs of the community.
Thank you, Jeanene, and lots of praise in the chat for your presentation and how insightful and thoughtful it was, and a nice dive into what you all are doing. Jen, as you think about the work your team did, landscape scan, any would lift up?
I think, you know, and I've worked in health departments. You know, it's hard when you're in the work. It's hard to think about what's the information that you need and that you want to know. And I think, and that's where we are right now. So you don't want to stop everybody and say, stop doing what you're doing and write it all down or count it all up. But as some people said throughout the chat and the Q&A, it will be good to know, what are we spending on this or on that? And What is the role of something like housing? Where does that fit? That's the thing that I'm sort of intrigued by, are the things that were not sort of the traditional approaches, but where everyone's recognized we got to do something different if we're going to make this work. So I think just trying to think about what information would be useful to know in order to plan from other jurisdictions, and then maybe coming together and figuring out some better ways to collect that data would be great.
And Jen, I would also add roles, because like I think housing might be a more appropriate role at the state level,
Mhm.
because they also are getting more funding to do that than maybe at a local level. So I think, and we're trying to identify that too, like what should the county be doing and what should the state be
Right.
doing?
That's important. That's very important, I think.
Thank you. Another lens and consideration for folks to bring to your planning. Huge thank you to Jen Kolker and her team at the Urban Health Collaborative at Drexel, Vahan and Allie. Hopefully Allie's at home with a new baby, so we're excited for her. And really thank you all for the deep work you've done to help us understand the current landscape. Huge thank you to you, Jeanene, for sharing, just coming here and bearing what you know, and sharing that and some of the considerations in a really transparent way, the things you all are still grappling with as questions. Before we conclude today's webinar, I would like to share some resources for folks on the call who might be doing similar work. This will be a part of, thank you, Elizabeth. This will be a part of what you get in the slides, but we want to make sure you are all aware of CDC's resources, which really lift up evidence-based practices and approaches to addressing substance use disorder, opioid use disorder. Next slide. We also have resources we've been gathering throughout this project that really speak to opioid settlement and what's going on in that landscape. Some of these have helped us understand, and our partners really stay abreast of what's happening out there through various resources. So we put some of those here, talking about what's happening with settlement and settlement spending. Next slide. And then just some additional resources here around evidence-based public health approaches to spending. Our next webinar is coming up on May 21st. And I'll tell you a little bit more about that shortly. But right now, I just want to encourage you to help us understand what's going on in your communities. A lot of you affirm some of the things that Jen and her team learned about what strategies are being resourced and funded through opioid settlement. And some of you indicated some of the barriers really being around not so much knowledge, but access. And so through our next couple webinars, we want to lift up what it means to work with people with lived experience, how we're defining that, which is also about families who have experienced loved ones who overdosed or maybe are using, and then lift up some approaches to doing that work and engaging them long term. We also will have a third webinar. That webinar will be May 21st, and it's called Supporting Decision Makers Using Opioid Settlement Funds, What's in It for the People, a Conversation on Engagement. May 21st, same location at 1:30 p.m. Eastern time. And then we'll do a webinar in June that will be about the importance of primary prevention and what a public health approach to addressing substance use and opioid use disorder. Some of the ways Prevention Institute and our public health partners are thinking of this. Please, I see some of you are already doing it. Take a moment to answer 3 brief survey questions or polling questions that we've shared. All responses are optional, but greatly appreciate you helping us understand the value of this webinar. Our project partners also appreciate this. Please take a moment to add any additional thoughts you may have in the poll. that has already been launched. Appreciate all of you who spent time with us here today. We had great participation, about 240 folks on the webinar today, and we hope you'll join us for our next webinar. Thank you so much and have a great rest of your day. Contact information, if you have questions after the webinar, is on this slide.